For Disease Control says a Northwest Indiana hospital did everything right. The hospital suspected a man who came to its ER last week had MERS virus.
The staff knew time mattered with this, so they quickly tested him, put him in isolation. When that test came back positive, WSBT's Kelli Stopczynski learned a whole lot more about Middle East Respiratory Syndrome today at a news conference in Munster. Kelli, the people he came in contact with not out of the woods just yet.
Jennifer, we're talking 50 employees at Community Hospital in Munster. They're all in home isolation as a precaution, being monitored and tested for MERS. His family in the same situation. The CDC also working to track down all 100 people on a flight that patient took from Saudi Arabia to Chicago, and another 10 passengers on a bus he took to Indiana.
Having the first case of MERS in the United States right here in Indiana is a scary situation.
Doctors say the unknowns scare them most, but they're confident they've done everything they can to keep this case of MERS from spreading, reaching out to everyone the infected patient had contact with.
Because MERS is a relatively new virus and we're still learning much about it, we're being very vigilant to follow these contacts for out to 14 days after their last exposure and continue to do testing on them.
The CDC says the MERS patient in a Munster hospital lives in Saudi Arabia and came to Northwest Indiana 11 days ago to visit family. He works at a Saudi hospital that had MERS patients, but he does not remember being in contact with any of them.
He has been improving every day, as was mentioned. He no longer has any oxygen requirements. He's in good spirits. He's eating well, and we have started the discharge planning process at this point. We expect him to be going home soon.
Doctors want people to know MERS is contagious, but it takes very close contact to get sick, like a caregiver or people living in the same house.
At this point, it appears that MERS picked the wrong hospital, the wrong state, and the wrong country to try to get a foothold.
So far, there are 261 confirmed cases in the world. The CDC says it started monitoring it closely about a year ago, educating people in the healthcare industry.
This is still a fluid situation.
And they don't think it's the last case of MERS they'll see on U.S. soil. Again, right now, doctors say this is the only documented case of MERS in the United States. The virus primarily found in the Arabian Peninsula, and that's obviously where they think it came from in this case.
So this 14-day isolation period we've heard doctors talking about, that's essentially them being cautious about this.
Exactly. The incubation period, they're saying anywhere from 2 days to 14 days. Usually, though, it's only about 5. They just want to make sure they're doing everything they can to prevent it from spreading.
And they mentioned he's ready to go back home, but what happens after that? Does he go back to Saudi Arabia, or where does he land there?
We don't know. That's all kind of still up in the air. They think he'll be on home isolation for a period of time. They say he's open to that. He's good with that. But doctors with the CDC, the World Health Organization, and State Health Department still trying to sort all that out.
Yeah.
Okay. Thanks, Kelli. And here's a timeline of how this MERS case unfolded. April 24th, that patient flew from Saudi Arabia to London, then on to Chicago. He boarded a bus to Indiana. 3 days later, he developed a cough and fever. His family took him to the ER. The hospital confirms he had MERS and put him in isolation April 28th. Then last Friday, the CDC publicly announced it as the United States' first case of MERS.
And as Kelli mentioned,